Hello and welcome to Verified Hearing. I'm Awajimijana Otana. I'm a clinical audiologist and I founded this clinic. I'd love to take a few minutes to tell you about the thinking behind what we do here. When I was training at the University of Manchester, one of the areas I became absorbed in was auditory science. Specifically what happens to sound after it enters the inner ear. So now most people know roughly how the ear works. The sound travels down the ear canal, the eardrum vibrates, and those vibrations pass through three tiny bones in the middle ear. They then reach a small snail-like structure called a cochlea. If you've never heard that word before, it comes from the Latin for snail. It sits deep inside the skull, about the size of a pea, just beyond the middle ear. Inside the cochlea then, there are thousands of microscopic hair cells which pick up vibrations coming in from the middle ear and convert them into electrical activity. That electrical activity then triggers the auditory nerve to fire. And the auditory nerve carries those signals to the brain. So the ear's job is mechanical. It collects the signal, it amplifies it and converts it. But then the signal enters the brain, and what happens next is where it gets generally fascinating. The signal travels through a series of relay stations in the brainstem before reaching the auditory cortex. And all along that pathway, the brain is doing something that the ear cannot do. It is turning electrical signals into meaning. Speech, music, the difference between a voice you recognize and, say, background noise, you can safely ignore. Knowing which direction the sound comes from, we call that localization. So following a conversation in a busy room. So the ear is collecting information, the brain decodes. And I became fascinated by what happens when the second part, which is the brain part, isn't working the way it should. The standard hearing test has been the foundation of audiology for 60 years and counting. It measures how sensitive the ear is at different frequencies. It is good at what it does. What it does not measure is what happens beyond the cochlea. It cannot tell you how the brain filters speech from noise. It cannot tell you how efficiently the auditory cortex is processing the signals it receives. It cannot tell you whether the central auditory pathway is working the way it should. And because those questions have never been part of the standard hearing assessment, they have, for most people, simply never been answered. You might have come here because your hearing is changing, perhaps a gradual loss over time, one that has been confirmed, and you want to understand what the right approach to your treatment really looks like. Or perhaps you have a child whose hearing has been affected by something like glue ear, and you want more than the standard advice. Or the hearing test that you did came back perfectly clear, but something still isn't right. Following conversation when there is background noise or you're in a group setting is harder than it used to be. Or there's a sound, a ringing, a buzzing, a tone that only you can hear. And you've been wondering perhaps for a long time whether anything can genuinely be done to help. In every one of those situations, what we offer goes further than what most people have previously encountered. A hearing aid, for instance, amplifies sound, and it does that part really well. But here is something that audiology has understood for some time and that rarely reaches the patient in practice. When someone has lived with a hearing loss over a period of years, the brain adapts. The brain is plastic. It reorganizes itself around the reduced input it has been receiving. So when you restore the sound through amplification with hearing aids, the brain still tends to process it the way it learned to with a hearing loss. That is why people with hearing aids that technically work would still say, I struggle to follow conversation, especially in background noise. The device is doing its part. The brain simply hasn't been retrained to use it, to decode that information. Our brain-based hearing program combines precisely fitted technology with a structured auditory processing protocol sessions. The technology restores the access to the sound, so it helps you detect it. The program teaches the brain how to decode it again. So both together is what you need. Tinnitus is worth a separate explanation because it is not simply a sound in the ear. It is a pattern maintained by three systems working together. The auditory system generates the signal in most cases. The emotional system then tags it, so your amygdala, as a threat, which keeps it active and gives it weight. And the attentional system, which has learned that the signal matters, keeps pulling it into the foreground of your conscious awareness. When those three systems are running together, addressing one of them only produces limited results, which is why that so much of what has been tried before has felt like managing the sound rather than resolving it. Our Neuroquiet Tinnitus program is designed to work on all three systems simultaneously. For a significant number of patients, the result is not management, it is the tinnitus recedes to the background where it no longer is the first thing they notice. We have two clinics, one on Harley Street and on Wigmore Street in central London. We offer the brain-based hearing assessment, the brain-based hearing program, the Neuroquiet program for tinnitus, auditory processing assessments for children and adults, children hearing assessments if your child is 2.5 years and older, and same-day earwax removal for children and adults. So you don't need a GP referral. You get your results on the same day. We're open from Monday to Saturday, including some evenings. Take a look around the site, read about what we do and who we are. And when the time feels right, I would genuinely love to welcome you to our practice. You can book directly from this page or just give us a call. See you soon.